Hi everybody, and welcome to a new One History Help video with me, Ms. O'Neill. This is the first in a 4-part series looking at public health in the Britain, the Health and the People AQA History course, also known as Medicine Through Time. As you can see, I'm going to be starting out today looking at medieval public health, and then there'll be future videos looking at the Renaissance, the Industrial Era, and the Modern Era as well. There are several different ways that public health could appear in your GCSE history exam. It could well be in a factors question, much like I've got on the screen right now. Has government been the main factor in developing public health in Britain over time? It could well be that it is in a source question. It gives you a particular source from a moment of public health through time. It could be a significance question, or perhaps they want you to compare public health from one time period to another. Now, there's no guarantees that public health will even come up at all, but it's quite likely from looking at previous history GCSE papers from AQA, thinking about the 4 types of medicine that we study. So causes of disease, treatments and preventions, surgery and public health. Generally speaking, all 4 of those types of medicine come up each year. So sometimes some come up more than others, but in most years, all of them are covered. So as this is the first video, we're going to be talking about public health. The one thing I want you to be aware of is that there are no guarantees of how it's going to come up or if it's going to come up at all. But it's always important to make sure that our revision covers all of those things. Has government been the main factor in developing public health in Britain over time? In this factors question, the factor that is given to you always strongly relates to the type of medicine in this question. And as I'm going to talk through with you now, when we look at the definition of public health, it goes hand in hand with government. So let's get a shared definition now of what we actually mean by the term public health. Public health is the way a government works to prevent disease and improve the health and well-being of the population. Public health can only be put in place by a government. So for instance, I couldn't turn around and decide that I as an individual wanted to put a public health measure in place. That is only done through the government. So as we're going to see in all of the videos that I'm going to be doing on public health, there is also going to be a little section in each video which looks at what government was like at the time, so during that time period, because there is a direct correlation, there is a clear relationship between the strength and involvement of government in a time period and what the public health measures are like. And this next little bullet point here isn't an exhaustive list. It's not everything that covers public health, but it is the main majority of what we need to be concerned with. So for example, governments providing clean water for people to access would be part of public health. Sewage systems is something that's going to be really important, in particular when we get into industrial public health. Vaccination programs, many of which I'm sure you have been privy to in your life. And also, even to the point of looking at people's living and working conditions as well. They all constitute public health. That's not everything, but that is the main part of it. In Britain in particular, it does also cover hospital provision as well. So this is what we mean when we look at the term public health. You may well be aware that in AQA, this paper is one that you are marked on for your SPAG, your spelling, punctuation and grammar. I have always tended to err on the side of using capital letters for public health. As you'll see, even in this little slide here, I've done a bit of a variation on that, but I don't think there's anything specifically that says public health has to have a capital letter in it necessarily. So just thought I'd mention that at this stage here. So furthermore to the definition, just want to go through with you a little flow diagram of what we mean by public health, because this is going to be how I'm going to structure the videos in this little mini series. So we're going to look at the concept of hygiene. So essentially, how smelly and dirty were people in these different time periods? What was their beliefs surrounding their own personal hygiene almost? Because that little insight there gives us also an understanding into public health measures as well. We're going to look through the lens of a specific disease for every time period as well, to allow us to reflect and understand the impact that public health measures have on epidemics. We're also going to have a look at hospitals, like I said, in Britain in particular, especially into the modern era when we get to look at things like the National Health Service. Hospitals do become part of the concept of public health. So because that doesn't happen until the modern era in terms of the government providing healthcare for all, I think it's important for us to look back on that through other time periods as well, to have a look at how that has changed over time. And then specifically, we're going to look at government. What were governments like in these different time periods? And with that in mind, what kind of public health laws did they pass? So as well as that shared definition we've just gone through together, this is also a little bit of a structure that I'm going to use in our videos talking about public health. So looking now specifically at medieval public health, this is how this video is going to break down. We're going to look at, first of all, the concept of hygiene. So how dirty and smelly were people during the medieval era? We're going to use the Black Death as a kind of lens to look at public health linked to specific epidemics. When we look at hospitals, we're going to look at the role of monasteries and the role of the church in providing care for people in times of illness. And then we'll look at what the government was like in the medieval period and therefore the impact that had on public health laws. Please be aware that whilst I go through these 4 different areas in the video, I don't necessarily do it in this order. But by the time the video is ended, all of these things will be covered. So let's start off with this question here, because this is a really, really interesting one in my opinion. How dirty and smelly were people in medieval Britain? Now, if I was to ask you to picture a medieval peasant, for example, you would probably imagine someone quite dirty with like mud over their faces and things like that. If I asked you to imagine the houses they lived in, you would probably imagine they would be quite pungent, they would be quite smelly. And I totally get that. That is definitely a media perception of how dirty and smelly the medieval period was. But actually, the truth is that people in the medieval era, no matter what your social class was, whether you were a peasant or a king, you cared about how dirty and smelly that you were. And the reason behind that is very closely linked to attitudes in the medieval era. Now, one of the main reasons why people wanted to be clean and not smelly was because at this time, dirt and smell were associated with being sinful. So if you were someone who didn't wash and therefore were really dirty and smelly, people would automatically assume that you were a bad person, that you were sinful. And if you understand the medieval psyche, the way that medieval people's minds worked, then that is the biggest insult you could offer to anybody. Remember how incredibly religious these people were? So they would do everything they can to make themselves as clean as possible. Now, let's just be aware as well, as historians, it is so important that we view people through their lens. And so, yes, while I say it is a common misconception that medieval people were dirty and smelly, they would still be dirtier and smellier than we are today. Our standards of hygiene are incredibly different, but it's wrong to say that medieval people didn't care about being dirty or smelly. That is just not true. They went to great efforts to make themselves clean. In particular, hand hygiene was incredibly important because everybody ate with their hands. Only the very, very wealthiest people would have things like very basic cutlery. And even then, most of them would have not used them and preferred to have used their hands instead. So having clean hands was incredibly important because everybody practically ate with their hands as well. One of the big problems, however, was getting access to clean water. Now, obviously, the richer you are, the easier this is. However, even if you are incredibly wealthy, having ready-to-go access to clean water, like for instance we would have nowadays, would have been almost impossible. The idea of having completely clean water is the only way you would be able to have access to clean water straight away is if you lived up in the mountains somewhere and you lived next to a mountain stream that was untouched by any kind of pollutants, like say down in the villages and the cities. That's the only way you would have complete direct access frequently to clean water. But for the vast majority of people, if we go back to the majority of the population, so over 90% of our population during the medieval era are peasants. In fact, incredibly high percentage in the Norman times in particular, 97% of our population are peasants. So we're talking about the vast majority of people. They would have washed and bathed in rivers and ponds and things like that. Maybe not ponds, maybe that's a bit of an exaggeration, but rivers definitely. And as we're going to learn shortly, rivers are also where people dumped their waste. So even then, they aren't getting the kind of clean that you would get with completely fresh, sparkling mountain stream kind of water. So, in a way, their attempts were really, really hampered by the fact that they didn't have that access to clean water. No such thing as soap at this time, really, certainly not in the way that we would recognize it nowadays, but they would have known that certain herbs and flowers would have given off particular scents. So even, for instance, the idea of trying to keep your teeth clean. Now, there was no such thing as toothpaste, but again, I go back to this idea that bad smell, like bad breath, was associated with being sinful. So quite often they would chew on certain herbs, like mint leaves, for example, would be a very obvious one to go to keep their breath fresh. But again, your access to that would vary completely. So how dirty and smelly were people in medieval Britain? Well, they were dirtier and smellier than we were today, but definitely not as dirty and smelly as the media would lead us to believe. So now we're going to move into the more government-related public health of the medieval era. And for us to get an understanding of that, we need to understand what government is like at this time. So in medieval England, and I say England rather than Britain because at this time, England and Scotland, for example, are not a united country. England and Wales have a unity between them, and there is no such thing as the concept of Northern Ireland at this time as well. So we're going to kind of keep it to England at this time. There is no elected government in medieval England. There is no elected government. People don't run for elections or anything like that. But as I will go on to, that is not to say that there isn't a parliament. Parliament does exist, but they exist as people who provide advice to the kings. And in England in the medieval era, it is kings. From a gender point of view, there are no queens in the medieval era. There should have been, but there weren't. And more on that maybe in another video one day. But for now, we won't get bogged down in feminism in the medieval era. Anyway, I digress. So Parliament exists. They are not elected. They are chosen by the king. They are usually made up of very, very, very wealthy people, nobility members of society, and also high-ranking members of the clergy as well. So like bishops and archbishops as well. And so they essentially live to advise the king, and also their main job is to go around the country and make sure taxes are being collected for the monarch. To use a specific phrase, we are talking about a time where England is ruled by absolute monarchs. By that we mean someone who makes the laws and does anything essentially that they want. It's a little bit more technical than that, but for the purpose of what we're looking at, the monarch makes the decisions. That is not to say, however, that there weren't any laws. There were still very much laws, and there were laws that affected the whole nation. So, for example, murder was illegal everywhere. However, what we notice is that laws in general, beyond the kind of obvious no-goes like murder and theft and so on, other laws vary across the country. A lot of local lords and also particular towns which have something called a charter were able to implement their own rules and their own laws that were unique to their town and were unique to the needs of their town as well. So for example, if you had a town down on the south coast of England, you would probably have very different laws compared to somewhere, I don't know, like say up north in the middle of England. So it would depend on the needs of your town. We also have a lot of very powerful groups within town societies as well. For instance, these organisations called guilds, which were mainly there for trade purposes, but they were so powerful and influential, they would have had an influence over the local laws that were being made. So where you lived really affected what laws you had to follow and how those laws were enforced as well. What does this have to do with public health? Well, this means that you could have a public health law that existed in London that didn't even nearly exist in Manchester, for example. So this is the idea we need to be aware of. People are not having a say in their government at this time. Laws still exist, but importantly, public health laws vary across the country. If you want to take a moment to pause this video and take a look at this picture in more detail. It is an outstanding picture. I absolutely love using this when I teach about medieval public health. So one of the questions I will often ask a class when I use this picture is, how many health hazards can you see in this picture? So in that little question there, feel free if you want to pause the video and look to see which ones you can pick out. Another kind of lighter question that I often ask is, how many features of medieval life can you see in this? Which is less to do with medicine, but more to do with us getting a sense of time period as well. So if you want to pause the video at this stage and have a look through, you are more than welcome to do so. I love this picture as well because it's one of those pictures where every time I look at it, I see something new. Every time I look at it, I see something new. And credit to the owner and the creator of this picture, of course, because the detail in here is exquisite. So I would say as towns go, this is quite a late medieval town. You're talking like probably mid to late 1300s that this has been produced. And as much as I would love to sit here and unpick all of the gorgeous medieval features that are in here, I'm not going to. I'm going to stay as focused as I can on public health. Now, I said before that the medieval people themselves tried their utmost to be clean and not smelly. But the towns that they lived in, like if I was to ask you to put yourself somewhere in this town, you would need to cover your mouth and nose because it would absolutely reek. And if you can see the like little white streams that are going down the middle of these streets, there is your answer for it exactly there. Because as I'm sure you're well aware, and there's actually somebody right at the center of the picture doing this exact act right now, people used to throw their waste out of the window. So there were no real situations where you would have had a toilet in your house, no matter how wealthy you were. There is an exception to that, and we'll come to that later on in this video. But at this time, you would basically do your business in a bucket, and you would throw that bucket out of the house, out of your window, and into the street. And again, you can see somebody right in the center of this picture here doing exactly that. So because of that, everything very much collected in the streets. The streets aren't paved either. The streets are these kind of like mud tracks, which you can see particularly towards the front of this picture really quite well. And because of that, it kind of seeps into the mud. It doesn't get really flushed away or anything like that. We can see that river supply running through the middle of the town. You would very, 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 very rarely get a town located anywhere away from a water supply. You would have needed a water supply both to be able to transport goods, but also to power things like a water mill, for example. And also, as you can see, lots of people are dumping more waste, not just bodily waste, but animal entrails into the rivers here as well. We've got people washing their clothes into this as well. And I even got somebody actually weeing directly into this river as well. I don't know if you can spot that person there. If you're not too sure, take a look at the bridge. Have a look at the bridge that's like closer to the front of the picture where what is a pub, and then there's another building being built. So if you look at the bridge there and the person just to the right in the red, there's someone right there kind of doing their business into the river. So the medieval people themselves tried their utmost to stay clean, but the towns that they lived in, their public health was so incredibly poor that the places they lived would have absolutely stunk. Now, we would have had a lot of overcrowding in these towns as well, because this is where the money's at. This is where you can go to set up businesses and so on. So many, many people flocked to the towns for exactly that reason. If you could afford to, again, I go back to my statistic from before, we're looking at well over 90% of our population that would have lived out in villages at this time. Now, one of the main things we need to be aware of in terms of public health is this idea of, whilst people didn't have toilets in their own houses, there were such thing as public toilets known as privies, or even a concept of a latrine. Now, a latrine actually dates back to the Roman era. It's something that the Roman Empire had in it, where the Romans went from country to country with their army. They built places where soldiers would be able to go to the toilet. So if you imagine like a square room, a latrine is like a square room, but with toilets around 3 of those walls. And when I say toilets, I mean a plank of wood with a circle cut out of it for you to be able to sit in. No doors or anything like that. It would all be shared, completely so. Now, jumping back to the medieval era, they had those as well. A privy is a bit smaller than that. A privy is just a toilet of its own. And quite often they would have been positioned over rivers. And the town would have funded that through tax, for example. And below the privies, or the latrines in particular, you would have had something called a cesspit. Cesspit, which was essentially, as it sounds, a huge hole in the ground where people's bodily waste would be gathered. Sometimes people, if the cesspit was exposed enough, would go to dump other type of waste in there as well, but generally speaking, it was reserved for bodily waste. And there was a job in the medieval era where people had to dig out and clean out the cesspits every so often. Now, you would probably imagine, like, if we had something like that nowadays, you'd be having someone clearing out a cesspit on a daily basis. Nuh-uh, not back in the medieval era, not whatsoever. The people who had that job were called gong, G-O-N-G, gong farmers. And it was their job to clean out the bodily waste from the cesspits. And they would not be doing this frequently. They would not be doing this frequently. Now, remember, whilst people do not like smell, like that's universal, people do not like bad smell. At this time, people do not know that dirt causes disease. They do not have that connection whatsoever. So because of that, cesspits are not cleaned out as frequently as you would imagine. Gong farmers would then collect all of the bodily waste that had been put together in these cesspits. And the reason they're called gong farmers, well, to farm something means to gather it in the first place. But all of that bodily waste would then be used as manure out in the villages, on the farms. Remember, we are talking about a country which relied on agriculture. That was our main business of our country, was agriculture at this time. So that's where they kind of recycled almost the bodily waste that was there. But they had that specific job there where the cesspits would need to be cleared out. And I would say, generally speaking, that wouldn't be to do with smell, but would be to do with the fact that the pit would be overflowing and it wouldn't be fit for purpose. So they would need to clear it out and possibly bury in the pit and dig a new pit elsewhere, maybe, or literally just make sure it was clean so people could use it again. So as you can see, the conditions in medieval towns in particular were awful. And remember, there is no elected government at this time. And the people who were advising the king are the wealthy. They are the people who wouldn't have lived in places like this. And one of the big things that we will notice in our study of public health is that unless it affects the wealthy members of society, they don't care. Okay, people who are over that 90% of the population in our country have no rights whatsoever. Or at least if they do, they have very, very little rights. So where it doesn't bother the wealthy, the king won't be made aware of it at all. So that's why we're seeing the conditions in the town be so incredibly bad. So what I'm going to do now is just go through a very, very brief timeline of some of the laws which were passed during the medieval era. And again, this is not an exhaustive list. This is not all of the laws that were passed. This is just a kind of handful, some highlights of laws that were passed that demonstrate that laws and measures were put in place, but they would vary from place to place. So going back to the year 1298, King Edward I, who was travelling north to go to battle with soldiers, ordered that the city of York were to build those public latrines for his soldiers. I mentioned the latrines in the last slide of the video here, so hopefully if you need a reminder, you can just jump back to there of what we're talking about. But again, it's very interesting, much like the Romans, this building of public health measures is associated with having a strong army, having a healthy army as as well. Again, not to confuse the fact that people thought dirt caused disease at this time. They don't. This is more this idea of making sure that they are in top fighting condition. Then jumping forward to the year 1310, and I know Scotland is technically not part of Britain at this stage, but nonetheless the laws there are a good example of how things vary from place to place in the country. So in Glamorgan in Scotland in 1310, butchers were banned from throwing animal remains out into the streets. There is a very, very strong connection in the medieval era, and you might be aware of this from your study of the Black Death, with animals being dirty and causing disease. And again, I know this is being contradictory to some concept because they don't know that dirt causes disease, but epidemics like the Black Death are blamed on animals. In part, there's lots of other things they blame it on as well. But this idea that animal entrails stink and are dirty and need to be disposed of properly is something that we start to see come through in the 1300s. In 1371, so we are after the Black Death now, and I'm making that point on purpose. I'm going to talk about the Black Death a little bit later on in this video. But in 1371, a law is passed in London, and again London only, which bans the killing of large animals within the city walls. So again, this idea of uncleanliness through animals is being continued, much like we saw there in Scotland. And then jumping into 1388, probably one of the strongest examples we have of public health laws, states that in London, again, remember this is specific of London, this law would not necessarily exist elsewhere, would not be necessarily enforced elsewhere either. But in 1388, again, we're talking post-Black Death now, a law was passed in London which fined people £20 for throwing dung, garbage and entrails, which is like, bits of animal waste, if you will, into ditches, rivers and ponds. So they're starting even more so now to ramp up the penalties for it. This is the first time we've got an idea of a consequence. People often ask me when it comes to figures like this, are we talking like £20 nowadays or £20 back then? Well, my quick answer is the answer can be found by looking at how much £20 back then would be nowadays. And £20 nowadays would be a couple of £1,000s. So the kind of concept of the change in money from there. Now, my quick and probably unsatisfactory answer is I don't know for a fact if that is like £20 nowadays or £20 back then. But what I will say is that regardless of the measure, it was still a lot of money. So it was still quite a significant punishment. But what I will say is there is no such thing as a police force in our country at this time. So whilst these laws exist, enforcing them was incredibly difficult. So whilst these measures are being made, it's very, very hard to see and hard to say how much people would have stuck to them. But again, remember, there is no elected government at this time, and laws vary from part of the country to part of the country. The penultimate thing we're going to have a look at in this video before we look at the Black Death specifically is the concept of hospitals. You may well recognise the source which is on the screen here. It's one that I use frequently with my students. It's technically not in Britain. This picture is of the Hôtel Dieu in Paris, but it is, I think, a very, very strong representation of the concept of hospitals. Now, just to be aware, there is no such thing as a hospital like we would recognize it nowadays back in the medieval era. And as I'm sure you are aware, all healthcare had to be paid for. Now, what you can see here is the closest thing to a hospital. And essentially, it is a place that was provided by the church. As you can see, the religious iconography in this scene here is huge, where essentially the sick would be cared for predominantly by nuns. But as we're going to see in a second when we move on to look at monasteries in more detail, that all monasteries, or at least all major monasteries or large monasteries in England, would have had what's called an infirmary, which was designed to care for the sick. As you can see, this hospital here does not hold that many people. In fact, most hospitals, quote unquote, I appreciate that you can't see me doing my air quotes, but hospitals, quote unquote, were designed to hold roughly around 12 people, to be reflective of the 12 disciples of Jesus. And as you can see in the image, it is all about the idea of providing rest and food and water, or ale more than likely in the medieval era, and importantly, prayer. We can also see one of the monks at the towards the side there on the left administering the Eucharist as well. So the big thing we need to be aware of here is that whilst medical care existed, medical treatment in these places did not. The closest thing to treatment they would have had would have been prayer. Now, as you can see in the image here, we've got a king actually visiting this place here, the Hôtel Dieu in Paris. Now, it's fair to say that these kind of places were open to rich and poor alike. And whilst, especially in the monasteries with infirmaries, their religious duty would dictate that they couldn't charge people outright. They couldn't say, okay, you can come in here for medical care. Medical care. We'll look after you. We'll feed you. We'll give you some like ale to drink. We'll give you somewhere to be able to rest. They wouldn't say, we'll give you that, but you have to pay us. Like there's a fee for it. They would never say that. But what instead would happen is the people who went to these places would end up leaving a donation. So whilst, yes, and especially in like the monasteries in England where the infirmaries existed like out in the wilderness as such, maybe some poor people would find their way there and through Christian charity the monks would look after them. It would still be very much kind of pushed on them that they need to leave some kind of donation. Wealthy people would obviously leave money. There is no two ways about it. They would very much want to do that. You know, we're talking about a time where people paid money for monks to pray for them, let alone give them what they would consider to be medical care at this time. But again, no treatment. But if we think about it, the medieval people would have seen prayer and the Eucharist and being cared for by the religious community as a treatment almost, because they believe that illness is sent as a punishment from God. So their religious beliefs here very much intertwines into the medical care that they are being given. So it's almost a trick question. What were medieval hospitals like? Because hospitals like we recognize them today did not exist in the medieval era. The monasteries of England are the exception to the public health rule. I mentioned before that if you wanted a ready source of clean water, you would have to go and like live next to a mountain stream. Well, monasteries are the closest thing to that. So a monastery would intentionally be built out of the way. You would very, very rarely find a monastery in the middle of a town. I say rarely because there's always going to be an exception to the rule. They are always built in a place of quiet and a place of solitude so that the monks that reside there can focus on their religious devotion. However, the monasteries were built in such a way that the monks had incredibly clean living. And I mean that in many senses of the word, but let's stick with it from a public health point of view. Monasteries were designed to be self-sufficient. Monks would have grown their own food. They would have been vegetarian with that in mind as well. They would have brewed their own ale as well. And they also would have had their own sewage systems. Now, I don't want to over-exaggerate and talk about it like a sewage system we have nowadays, but the design and location of monasteries was done intentionally to make sure that things like bad smell didn't hang around. Because if you remember from earlier on in the video, bad smell equals sin. And that's the last thing you want hanging around in a monastery. With that in mind, they had the closest thing to a flushing toilet at this time. And I don't mean a flushing toilet like we have nowadays, but I mean they had privies and latrines where your waste would be dumped and carried away. You can notice here the part of the diagram on the right hand side where it says dealing with waste. Well, that's almost like the sewage pipe, if you will, out of the latrine or the privy that they have, the toilet that they have in the monastery, right into that river. Now, I don't know how clear it is in this picture. Maybe once I say it, it will become clearer. But they intentionally designed this so that the waste flowed away from the monastery when it went into the river. So it never hung around or anything like that. It always flowed away from the monastery. So they did that very, very intentionally. This kind of design and the kind of things they had access to there like that would have cost an absolute fortune. So the question on the screen here asks, how and why did monasteries have such good public health? Well, I've told you a little bit about how, the idea of the cleanliness being so important to them. One thing I haven't mentioned here, for example, is that the idea of cleaning was a big part of a monk's daily life. The idea for many of the religious ceremonies, most monks would have prayed up to 8 times a day, and would have been, again, eating with their hands. They would have been required to be clean. And again, this idea that dirt and smell is associated with sin, they would have lived incredibly clean living. And with that in mind, I talked previously about how most people who also try to get clean would have washed and cleaned in the rivers. Not the monks, not that at all. They would have instead have had specific wash houses. And you can see it here on the little diagram here. So almost like a bathroom, essentially, where they could get clean using the supply of water from the river. And again, because the monasteries are built out of town, that river supply is clean. Unlike if you think back to the picture I showed you of the medieval town that we looked at, that river supply is filthy. This is clean. So they would have siphoned off water, clean water from the river to be able to wash in regularly. Again, incredibly expensive, incredibly expensive. Why were they able to have this? The church in this country was crazy rich at this time. Monasteries in particular, I always think it's a bit of an irony that monasteries were some of the wealthiest places in the whole country, considering that the monks in them lived a life of poverty. But despite that, this idea of having the way that it's designed with quote unquote, again, I know you can't see my air quotes here, but flushing toilets and specific wash houses that siphoned off clean water, that was incredibly sophisticated, incredibly expensive, but to the church, which was incredibly rich at this time, it was nothing. It was nothing whatsoever. So it is no wonder that when people went to visit the infirmary to get better, even though they weren't necessarily receiving medical treatment, because they lived in such a clean place, it is quite likely they would have seen their health improve. Depending on obviously what they had. If they went there with an illness that was going to be ultimately terminal, then obviously that wouldn't help. But if you went there in a position where you could technically recover from your illness, then the clean living and the clean standards of the monastery would have helped tremendously with that in mind. So finally, we come to looking at a specific disease which links back to public health. And the disease of the medieval era is the Black Death. Now, I need to be super, super clear with you on this point. The Black Death was not caused by poor public health. This is really, really important. And one of the reasons we know that is the case is because both rich and poor people alike were affected by the Black Death. So it doesn't matter what your living conditions were, you could still get the Black Death. So the Black Death was not caused by poor public health. However, poor public health allowed for the Black Death to spread rapidly, especially the overcrowding in those towns. So the Black Death is not caused by poor public health, but the fact that it spread so quickly and so widely is because, in part, to the poor living conditions that people lived in. So that's a really, really important thing that we need to be aware of with that in mind. But the connection between the Black Death and public health is more so seen in the aftermath. So in terms of what happens when the Black Death is over. At least 1/3 of the population die in the Black Death. That is the lowest possible number. And actually, the more and more that historians are learning about it and the more and more we are seeing parallels to other epidemics that have happened, that figure seems tiny in reality. So 1 in 3 people die of the Black Death. I love teaching about the Black Death. I think it is so incredibly fascinating. It's one of the things I studied a little bit when I was at university many, many years ago now. But nonetheless, it's such a fascinating topic. And one of the big questions that people often ask me when I teach it is, could you survive it? Is it possible that you could survive the Black Death? And the quick answer is yes. The longer answer is yes, but that was incredibly rare. And it was even rarer to get the Black Death and survive it. They often ask me then, well, why do people stop dying from it? And it's because of our immune systems. We naturally start to build up an immunity to it. For those people who survive the Black Death, they will see a dramatic change to their lives, particularly those poor peasants. And I want to refer to something that you may well have remembered learning about maybe earlier on in your schooling, in your history education. If any of you study the Norman Conquest as part of your GCSE history, you will be aware of something called the feudal system, where it's like a pyramid shape where the king is at the top and then you've got the peasants at the bottom. Because so many people die in the Black Death in England, the feudal system collapses. It can't work anymore. So because of that, we start to see a lot of people who used to be incredibly poor be able to demand more money for their labour and therefore start to demand more of a change in their rights. So with that in mind, we start to see public health laws become stronger and stronger. You may remember from a couple of slides ago when I was going through that timeline, I very much intentionally told you the laws that were passed after the Black Death was over. So for example, that £20 fine that existed in London was created after the Black Death. So people are starting to make the connection between poor public health and disease. They haven't hit the nail on the head, but they're starting to wonder, oh, there must be a bit of a link going on here. So we start to see stronger public health laws in some cities, but I go back to what I said in that slide with the timeline in it. We need to be aware that although these laws existed, the enforcement of these laws was incredibly difficult and not particularly consistent. And then finally, and this is going to be really important for when we move on to our next video looking at the Renaissance and public health and Renaissance, the Black Death sees a decrease in power of the church. One of the big consequences of those people who survive the Black Death is them questioning their faith. It's one of the big reasons why we get the Protestant Reformation during the Renaissance. But essentially, people who survive are like, I prayed my hardest, I gave my money to the church, and still my loved ones are taken from me. So a lot of them start to think, well, if God is so loving and benevolent towards us, why has he let this happen to us? And that leads to people start to question things. And therefore, it starts to allow new ideas to push through the fore. Now, to be very clear, and I'll explain this more when we get to the video on the Renaissance as well, that doesn't mean to say people aren't religious anymore. Absolutely not. Religious belief is still incredibly strong, just not quite as strong as it was in the medieval era, because now we're starting to get new theories and new ideas, for instance, relating to humanism and science start to come to the fore and challenge that stronghold that religion had over people's way of life during the medieval era. So like I said, whilst the Black Death is not caused by poor public health definitely allows for the impact of the Black Death to be significantly stronger than had public health been better. And the big impact we see happens when the Black Death is over. So let's finish up by summarising medieval public health into these 5 key points. Like I said, it's a misconception to say that people didn't care about being dirty and smelly. They did, but the places they lived in were incredibly dirty and smelly. Whilst there is no elected government at this time, laws still existed, but they vary across the country and were very difficult to enforce. Hospitals like we recognise them nowadays didn't really exist. The closest thing we can use are the infirmaries in the monasteries, where the sick would go to be cared for, but not to receive medical treatment. Monasteries were the cleanest places you could go in the medieval era, and I talked about all the different reasons as to why that was. And then finally, the Black Death is made worse by poor public health, but it is not caused by it. And there we have it. A summary of public health during the medieval era. I hope you enjoyed this video. I hope you found it useful. If you did, feel free to give me a like. There won't be any comments open, I'm afraid, because of when you list on YouTube that videos are created for students, then you're unable to make comments. But if you could give me a like, that would be amazing. I also have an account on Instagram, so if you want to go and follow me there, you're more than welcome to do so. Feel free to hit subscribe, and hopefully I'll see you in our next video, which looks at Renaissance medicine. Thank you so much, everyone. Bye-bye.